My name is Kaylee. I'm an acupuncturist by trade. I helped establish the integrative program over at Osher back in 2020. And since then, we've kind of expanded our available services quite immensely. So what is integrative oncology? So what we try to do is make sure that it is a program within the health system that is patient-centered, it's evidence-based, helps utilize everybody's practice of how they treat their body, how the products they use affect them, lifestyle modifications to help reduce chances of recurrence of cancer and treatment while they're in cancer, alongside with their normal routine for like if they're getting active treatment, if they're getting radiation, we're not going to replace that. So the aims is to optimize your quality of life through treatment. We want to make sure that your outcomes are as positive as possible. We want to make sure we are around before, during, and after your cancer treatment so that we can help recover as much as possible. Okay, so the goals. We want to have the multidisciplinary approach. So we want to approach you as a whole person. We don't want to just focus on one aspect of your treatment. We want to make sure that you are actively moving, which I know we talked about that a lot today. We want to make sure that you're eating properly. We want to go over your supplements. We want to make sure you're treating yourself well and having your anxiety taken care of. Because of that, your whole mind and body, if you have a positive outlook to the treatment, you're more likely to have an easier treatment. So, where can we help? So newly diagnosed is usually the most whirlwind for most of our patients. We have a huge anxiety and stress reduction. We do that with acupuncture, we do that with movement, we do that with Dr. Murray. We make sure that we have that access so that you are feeling confident in going into the treatment. We make sure we target insomnia, because if you're not sleeping, you're not going to recover where you need to. Pain, especially newly diagnosed, we want to make sure that your body is actually being able to recover. We can target that pain with PT, with our occupational therapeutic yoga. We can do it with acupuncture. We can do it with general movement meditation classes. So during chemo, we like to make sure that we're able to treat your neuropathy if you get symptoms of neuropathy, nausea, vomiting, fatigue, chemo brain, which I don't think is actually studied yet, is it? It's just they're not sure, but I've seen it, I know it's real. Bone and joint pain, anticipatory anxiety, which we touched on a lot. Pre-surgery, we want to make sure that you are moving, we know where your baseline is, so we can get you as close to that as possible after. And then the same with radiation therapy. A lot of things can happen post-radiation that patients aren't aware of. We try to discuss that as much as possible and help curb those symptoms. Fatigue is the biggest one that I see, but there is some for xerostomia for our head and neck patients, which doesn't apply here. So I pulled this off of the SIO so we can kind of see what integrative medicine can do to help with symptom control. So pain is statistically shown that acupuncture can help a lot with pain. Massage, we actually started integrating oncology massage into our program as well, and it's been a huge benefit for the patients because one, they miss it when they think they can't do it anymore. So it's able to kind of get them moving and get that stress muscles out. And meditation. Meditation is extremely beneficial to patients to help kind of get their stress levels reduced. It's shown very, very much to have great support in that aspect. Fatigue, we all know movement is the best for fatigue. Even though you don't want to, when you're tired, it really does help. There's some great protocols with acupuncture as well to help with this. Insomnia, Tai Chi, yoga. We don't do CBT much, but it's something everybody can explore. Anxiety, and then of course the symptoms that are very, very common within chemo care, which is nausea, vomiting, neuropathy, dry mouth, and hot flashes. We have options for a lot of mind-body programs, which really including meditation, yoga, Tai Chi, Qigong, all those type of classes I would highly suggest getting into when you are going through your treatment. Art therapy, music therapy, all great options that we have within the system. Survivorship. So while I'm not as versed in this, because Dr. LePere, our integrative medicine doctor, is the one who kind of runs that whole program, she has been a great resource to help with patients who, during and post-treatment, to go through what different type of supplements you can take, new medications on the market that will help post, like breast cancer, for example. There's new things that can help with hot flashes if you're on aromatase inhibitors. It's just been a really great access to have, because patients can see her all through cancer care. So having a survivorship MD is a great connection to have. The debunk myths is my favorite part. So I cannot tell you how many times I get messages from providers with a list of Chinese herbs that people just order off Amazon and are taking all these things and don't know the contraindications of those with the active chemos they're taking. So some of them will completely negate your chemo. High doses of certain things that will clear your liver too fast and you're not getting the treatment you need. So we're able to kind of work together to make sure that you're getting the best benefit out of your cancer treatment.